Welcome to Dental Success Beyond Chairside, the podcast that is dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts and valuable tidbits of information to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of topics, including HR, marketing, innovative techniques and systems, and AI, to help you transform your practice and unlock its full potential. Whether you're a dentist, specialist, or oral health therapist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Get ready to go beyond the dental chair and discover what lies ahead in your practice journey with Dental Success Beyond Chairside. As clinicians, you know that patient trust is everything, and yet it's often the hardest thing to build in a short appointment. A patient might not remember exactly what you said, but they'll always remember how you made them feel. Joining me today is Dr Sugz Mahalingam. He's a general dentist and communications strategist who helps dental professionals master the art of patient communication. With a background in clinical dentistry and persuasive psychology, he understands what truly drives trust, engagement, and treatment acceptance. Dr. Sugz, thank you so much for being here today with us.
Thanks for having me, Michelle.
Really appreciate it and looking forward to what you have to share. Speaking of sharing, can you share a bit about your journey and let us know, as a clinician, how you build trust with patients to put them at ease and help them understand and accept your treatment recommendation?
Sure. I am a general dentist. I work in practice about 3 days a week and work in private practice. So in the UK, we have the public health sector and the private sector. I've left the public health sector now. Works purely in private dentistry, and on the side, I've been developing my copywriting agency called Maha Copy, which is working with healthcare businesses. So not just in dentistry, medicine and software and health tech, and helping them be basically more persuasive, helping them with their advertising. What I began to realize was a lot of the principles that apply within marketing actually transfer really well within clinical dentistry. That's how I began to really explore how communication can be improved within the dental setting using some of these principles. To answer your question about how do we build trust, a lot of it is exploring what the actual driver is behind what patients really want. That's something that we don't do often as dentists. We're almost like tooth mechanics. Patient comes into our surgery, they come with a problem and we fix it. But actually we don't go into what the drivers are behind them wanting treatment in the first place. Not everybody wants the same thing. That's one of the important things that I think we need to uncover before we even embark on treatment.
So essentially asking the patient open-ended questions to get them to understand, because often, especially in general dentistry, there's a lot of anxiety and apprehension about coming to the dentist.
That's it. Yeah, exactly. For example, some people are very driven by, as you said, anxiety and fear. They're scared of either pain, losing their teeth, previous bad experiences. Some people are driven by that, but some people are driven by aspiring for a better appearance for whatever reason. And that could be for personal reasons, professional reasons. So everyone's got a different driver. You can't paint everyone with the same brush. And that's so important when you're thinking about treatment options and discussing high value treatments, especially. That's an important thing to understand.
Yes, that's right. So I was actually just talking with Brooke Opulent from Canada. She deals a lot with treatment coordinators, and it is orthodontics, but we were just saying, like, a good thing is to get the patient to look into a mirror and say, what don't you like about your smile or your teeth, to get a full understanding. It's really exploring and asking those questions. Is that what you're alluding to, Dr. Sugz?
Yeah, exactly. And exactly as you said, really, because a lot of the time what we're taught in dental school is a patient comes in with a problem and you give them these 5 templated options. Let's say, for instance, someone's missing a tooth. You give the same options whether they're 24 or they're 84. In principle, that sounds amazing. Everyone should get the same options and it's informed consent, and that's amazing. But the problem is the 24-year-old is completely driven by different things to what the 84-year-old is driven by. So by asking those pre-filtering questions is what I call them, you can tailor the options to what the patient wants rather than just a default list of options that you were taught back in dental school.
Yes, informed consent is very important. I know my husband, who was a dentist, and when he used to explain treatment, he goes, I've got to give them all the options of what's available to them because I'm under a legal obligation to do so. What are your thoughts with regard to that, Dr. Sugz?
I have a list called the Convergent Collective. It's a community of dentists. We talk about things like this all the time. And what's one of the most common questions I get, and it's one of the things I battle with, which is you've got this informed consent piece, which is protecting us medico-legally, making sure that we're informing the patients of everything. But equally, I've had patients where I've kind of gone through all the options and they end up more confused than when we started because they end up blank-faced and they look at me and they say, well, you're the experts, kind of thought you would tell me what's best. Then we're both kind of stuck there. I'm like, no, it's your body, it's your choice, which is true. It is true. But they want to be guided. I don't think there's anything wrong with dentists making a recommendation based off the information that the patient's given them. That's fine. But there's a fine line between making a recommendation and forcing them down
And
a specific
something
path.
really nice as well that I've heard in communication with people is to say, I'd have a child a similar age to you. If this was my child with this issue, this would be my recommendation because. Do you think
100%.
that that's quite a, and I think that is a really nice thing. That's where sometimes dentists, especially when I spoke to Ross, he's like, no, I've got to give them everything. But exactly what you said, like if people are just there and they're just getting blah, 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 and you're just sitting there and you're the expert. I just want you to tell me what to do. I'm not clinical at all. So I really appreciate that from that aspect of understanding. I've come to you because you know what you're doing. So you tell me, this is what I want. What can you do?
Yeah, exactly. The key word that you said there was because. I'm making this recommendation because
Because.
of what you've told me. I think it's patients only feel kind of railroaded when you are making a recommendation and there's no basis to what you're saying. That's when patients start to kind of think, okay, is this a sale? Are they trying to sell me the highest possible price treatment, or is there a reason why they're suggesting this?
And that's part of being genuine and authentic when you're actually talking to the patient as well. And listening is a really big thing. I read an article a couple of years ago and it was talking about medical practitioners. I think it was talking about GPs. They don't even listen for 20 seconds and they interrupt.
Yeah. The thing is, it's so common because, well, especially within dentistry, because if you're seeing, let's say on average, a clinician might see 15 to 20 patients, maybe even in the public health sector, that can be up to 30. You're seeing patients who are coming in with the same kind of problem every time. It's very tempting for the autopilot switch to kick in your brain and think, okay, you've heard the first two sentences, and we all do it. I know what the problem is already. I don't even need to look in the mouth. I know what the problem is. Then you've already got your treatment options. You've got the preconceived treatment options in your brain, and you spout them out without bothering to listen because you just assume that everyone's going to present the same way. That's the most important thing, is to try and treat every patient with a blank slate.
Yes. And not
That's
have
the most
those
important.
preconceived ideas. And
Exactly.
this is interesting. When my daughter was about 4, we were in the supermarket, and there was a person in a wheelchair, and she just goes, "Mom, look at that lady!" I just went and froze and thought, "Oh my gosh, she's going to say something about this poor lady who has a disability." She goes, "Look
God.
at the colour of her hair!" This
Uh,
preconceived idea that's what she was going to say, and I literally wanted the ground to swallow me. And when she said it, the lady just looked at me and we just laughed. So yeah, it's really being very open-minded, and it's just treat each individual as an individual for who they are.
yeah, absolutely.
I think as well, I've heard a lot of dentists go, "Oh, it's not a sale. Like, we're not looking for a sale." But if you are really wanting to help patients and get the best they can with their overall health, you need to explain how that's going to help them at the end. At the end of the day, they've come to see you. There's an issue. You haven't actually gone out and said, "Come here." They've
Hmm.
actually come to you. They've done a lot of research, probably. Patients are much more informed now and know a lot about their oral health before even coming to see you because they've done Dr. Google. What are your thoughts around that, Dr. Sugz?
I agree, to be honest. Like you can't really predict exactly what a patient is going to say. You really do have to kind of come with a kind of active listening kind of protocol. I guess the best way to explain it, and I don't expect every dentist to act this way, but I'm quite laid back with my patients. So I have, in fact, the first 2 minutes, I always try and make sure it's as non-clinical as possible. Really just talk about their personal life. That gives you so much insight into what their drivers are actually going to be. And going back to your concept about sales, that's an interesting one. I find that a really interesting one. That's quite a controversial topic amongst dentists because sales it's got a bad connotation. Maybe that's other industries that expected that whole definition. Ultimately, if you're trying to serve the patient, I don't think sales is a bad thing. As you quite rightly said, they come to you with a problem. You're just trying to you're trying to serve them with the best possible solution using your clinical expertise. So I don't think that's a bad thing. I just think it's a poor connotation of the word, and that's an internal mindset within the dentist. It's got nothing to do with the patient. That's all within yourself and your preconceived notions about sales and persuasion.
When you said you were doing your marketing and you saw how it transferred to clinical, like what have you got some practical examples of what you actually saw so that our listeners can understand what perspective you were coming from?
Yeah, for sure. Just to give really basic bare bones mindset into what I was doing something called copywriting, which is basically advertising and writing pieces. So that could be emails, ads, whatever, to persuade people to take an action. In essence, this communication piece is the same. You're still communicating with patients. That was just written, but I'm just transferring that into verbal communication with the patient. So in terms of practical tips that I could kind of give someone who's listening to this, one of the key fundamental frameworks that we use when we're writing advertising, for example, is something called problem-agitate-solution. That's a framework. And what that means is you present the patient with a problem, you agitate the problem, i.e., you go further, you go deeper into the problem, and then you offer the solution. Now, within dentistry, there's a fine line there. Agitate probably could be exchanged for something else because you're not trying to fearmonger. You're not trying to tell the patient your teeth are going to fall out if you don't do this. That's wrong. But you do need to make them aware of what the consequence is if they choose not to take you up on your recommendation. That is a fundamental piece in terms of converting a patient, because I think a lot of the time human nature is to avoid. Patients look at it from a perspective of, if whatever the price point is, they're looking at it from a perspective of, I could just deal with this later. It's not hurting me right now. You just need to spell out to the patient exactly what could happen if they choose to go down that route of delaying treatment. Then the solution is offering whatever the options are.
And quite often there is those things that are happening in the continuing care appointment. I don't think that they're verbalised enough to sort of say, look, this is what's happening with this tooth. Can you see it here in this photo? The importance of coming back for us to monitor it, because in the long term, if we don't do anything and it gets worse, it's actually going to cost you a lot of money. That sort of thing. That's a good way of putting it with regard to that. I mean, you're doing the best thing for the patient too. I think that's informed, not consent, that's informed advice. This is the problem. This is the solution. This is the consequences of not taking it up. And this is why I recommend this solution. Whether that is when it's not really doing anything, we need to make sure that we look at it in 6, 9, 12 months, whatever you recommend for them to come back for their continuing care, so you can monitor it and oversee it properly.
That's it. And also, actually, one thing I want to add on there, a big concept that I learned from a seminar that I went on. It was a copywriting seminar, actually, but I applied to dentistry. And there's a famous copywriter called David Ogilvy. He mentioned a concept called one big idea, which I thought was really interesting. One big idea is basically, whenever you're writing advertising, you want to talk about one specific idea, one specific benefit, one specific problem, one specific solution. Why that applies to dentistry is often when patients present with multiple issues, it's very tempting to try and solve everything, be Superman, and come with a massive comprehensive treatment plan of all the possible things to address their gum disease, their decay, their broken teeth, their discolored smile. And you're trying to attack multiple problems in one appointment. But actually, if you come with one overarching big idea, whatever that is, you focus on that one big idea, you focus on that one problem and that one solution, you can develop the treatment plan as you go along. So rather than overwhelming patients with a massive treatment plan at the beginning, what I often tend to do is I often make patients aware of all the problems. If they're coming, let's assume the patient's not been there for 15 years, not come to a dentist because they're anxious. The last thing you want to do is scare them away with multiple problems. They're coming out with a double-sided treatment plan with a massive number at the end of it. Rather than that, I make them aware that, look, there is a lot of treatment that I think is needed, but let's start one step at a time. I think we should start with this. This is the reason why. Then once we've solved that problem, then we build the treatment plan in the next appointment. We add on the next thing rather than overwhelming them.
That's like what I do from a business perspective, because as you know, I'm not clinical, but it's just one thing at a time. And over time, you get the solution that you actually want at the end.
Exactly.
That's very important. Dr. Sugz, is there anything that we haven't discussed that you would like to share with our listeners?
Not particularly, but I'd say just in terms of a takeaway for any dentist who's looking to kind of improve their communication, I would just try and steer away from using scripts. I think it's really tempting for dentists to go on courses and learn these scripts or magic phrases or magic things that you can say to a patient to make them take up your Invisalign or whatever it is. I think try and veer away from that and focus on the core principles behind what makes patients take action.
Yes.
Understand the psychology. I think that's more important than using a script. I'm different to every other clinician listening to this podcast, and we're all different and we're all unique. We've all got our unique ways of communicating. If I give you a script of what I say, you won't be able to apply it the same way and vice versa.
Verbiage is still very important. Getting an understanding of how you work and what you're trying to extrapolate is important as well.
For sure.
That's excellent. We've got a few things here. The one big idea, that was a good one. And obviously the problem-agitate-solution, no scripts. For more information about Dr. Sugz, please see our show notes. Thank you so much for joining us. I know it's first thing in the morning for you, later in the afternoon for us. So really appreciate that we were actually able to make the time to meet, and appreciate your insight and sharing your knowledge. Thank you so much, Dr. Sugz.
Thank you.
In our next episode, we'll be continuing the conversation around communication and treatment acceptance, this time through the lens of an orthodontic treatment coordinator. I'll be joined by Brooke Oliphant, founder of Rise Up Coaching, a strategic growth consultancy for orthodontic practices. Brooke specialises in elevating the new patient experience, increasing same-day case acceptance, and developing treatment coordinators into confident leaders of conversation and decision-making. We'll be talking about how practice owners can better support their treatment coordinators to communicate with clarity, build trust, and help patients feel more comfortable saying yes to treatment without pressure or scripted sales language. Thanks for listening to Dental Success Beyond Chairside. See you next time.